person is different than the skin of a younger person. It's drier, it's less elastic, there's more bony prominences underneath it because it's kind of atrophied or shrunk, so is the soft tissue underneath it. So the skin is less resistant to shear forces, friction, pressure. It's drier, so it's also more prone to calluses and things like that. So maintaining good foot hygiene means not just staying clean, but also keeping the skin kind of moist. But when it comes to shoe fit and trying to avoid pressure spots, it can be a little bit harder because some of the, for plenty of our patients and customers, like the fifth metatarsal, for example, won't be a bony prominence when someone's in their 30s or 40s, but as their soft tissue shrinks, then all of a sudden they have this bone that sticks out and it gets pressure. Same thing up in the digits, right? You guys have seen like hammer toes or people getting pressure. Well, part of it is it's not necessarily that bone sticking out more, it's just that the soft tissue that used to pad it has kind of shrunk down. And so that can be an area that we would also watch as a potential area that could get a sore or an ulcer, any kind of bony prominence like that. When it comes to calluses are like our little warning signs, and I always tell this to a patient too, that whenever I identify where the callus is on their foot, I tell them this is the most likely spot you will develop a sore or ulcer if you ever develop one. So that's where you have to be careful. And when I kind of teach them how to manage their calluses, it involves moisturizing them, and then for some people that don't have loss of protective threshold sensation, I will give them advice on how to just use a gentle pumice stone to remove some of the thick skin and dry skin that can build up. Some of our patients will use like razors on themselves. That's obviously not a good thing for patients who have diabetes. In fact, most patients shouldn't use those things. And some of the callus treatments, like there used to be, I don't know if they're still running that commercial, that pet egg thing. Have you guys seen that? It's like, it looks like a little cheese grater to me. It's like kind of shaped like an egg, but it has a metal thing to shape. I've seen people kind of gouge themselves with that. I'm kind of horrified with any callus treatment that looks like it's metal. Is crazy. The safer ones to use are have kind of a sandpapery texture, and that's what I tell my patients. Don't use any of those cheese grater ones. But if I feel like they have the skills and the motivation to do it safely, I'll give them advice on just using something to manage their skin that way. But there's also good lotions for that, and that's something you guys don't have to worry about. But it'd be, well, here would be a common question that I get in clinic, and you guys probably see. They'll come in and say, well, I have a callus right here. Can't I just cut it off and get rid of it? And my answer to that is always no, you can't, because the callus is a symptom of pressure or friction. It doesn't arise randomly. It's not like a wart or something that's a little viral thing that got into the skin. So sure, you can shave away a callus, but it's just coming back because your body's protecting itself from pressure or shear force or friction by making itself thicker. So addressing a callus involves really three things. Relieving the pressure, so sometimes that's with an insole or a good fit of a shoe. Sometimes it's kind of customizing things a little bit to offload an area. It involves keeping the skin moist and soft, and that's where I typically recommend like an off-the-shelf lotion or sometimes a prescription lotion. And then it involves using that pumice stone or something from keeping it from building up too much. And so that's, a lot of people, I don't know if you guys get that question very much in the store, if there's a shoe or insole that will get rid of your calluses, and the answer is no, but there are some things you can do as a part of the puzzle, but they still need to do things daily themselves to manage them. And then when it comes to ulcers, and this will be the last part of what I'm going to talk about here, and then we'll just open it up to questions. So an ulcer basically means that the skin can't withstand the forces that are acting on it. So our first defense with pressure or friction is going to be a callus, and then if pressure or friction persists, the callus and the skin underneath it actually start to break down. And so an ulcer is an open sore, and our skin is our primary defense against infection and disease, right? So it's a barrier. Once there's a compromise in that barrier, that's when bacteria, fungus, and other invaders can get in and start to cause further damage and profound infections. So any compromise in the skin, and it starts with simple things like dryness, cracking, or calluses, they can progress to ulcers. I don't think you have to worry about identifying or doing like this whole, foot inspection thing on every single patient. That's really not the role here. But I mention it because sometimes you can recognize the warning signs. If someone says, I have kind of a spot on the foot that's bugging me, I don't think it's bad as a shoe fitter to at least, you guys are going to do this anyway. Okay, where's their pain? Okay, what kind of shoe is going to help with that? That's what you're doing 95% of the time anyway. But if it seems like a little out of proportion, or they have diabetes and maybe have a funny shape to their foot, then you might say, well, maybe a shoe, you could look at it a couple ways. You could say, well, this is a shoe we could steer you towards, but the shoe is not more important than probably seeing your doctor for this at this point. And either say, why don't you come back and get the shoe, or we can fit it and hold it, or if you want to take it today, you can, but don't lull yourself to sleep that getting a new shoe is going to solve this problem for you. Okay. So I think those are the relevant things when it comes to diabetes, and it's not a super exciting topic for a lot of people, and a lot of it sounds kind of scarier than it is. But again, I think you guys in your stores are going to see people that are pretty motivated. They wouldn't be coming to a good store and willing to spend good money on shoes if they weren't already concerned about the health of their feet and their activity level. So I think for the most part, you're going to see the healthier kind of diabetic population, but being aware of some of the things that could potentially happen to them down the line are good things. And then I guess to complicate it would be the neuropathy. Some people aren't even aware how much neuropathy they have. And so for them, they may not even be aware that they're missing the boat on some things. And the other thing that, I won't go into too much detail, but would be good when we do like our older patient talk, is that neuropathy affects balance too. And so some of our patients with neuropathy are going to have poor balance. Okay. Any questions, anything I didn't cover or more details that we want to go into?
So at what point do you actually, do we ask the customer if they're hinting at the fact, some of these points that you mentioned about the diabetic foot, do we ask them, are you diabetic? At what point do we kind of intrude on their...
Yeah, that's a good question, Jim. I would say this, and again, everybody's a little bit different in terms of how private they want to be. If they're kind of alluding to that fact or heading in that direction, I think they sort of open the door to talk in more detail. One question I always ask my diabetic patients in clinic is, have you had an ulceration before? Or do you have any burning, tingling, or numbness in your feet? I don't think it's too bad to ask if you have burning, tingling, or numbness in your feet. I think that's a relatively innocuous question, and it's important for you guys, not just for how you want to fit a shoe, but also because it might affect their balance too.
Sometimes I say it, if they tell me they don't have a good feeling, and then I'll ask if it's okay if I ask, do you have diabetes or are you diabetic? Is that okay to ask them?
Yeah, that's a good question. I don't know. Well, I would say this. It's not going to change how you fit them at that point. If they already said they have numbness, that's probably all you need to know. So, and like I said, 30% of people have numbness in their feet and we don't know why they have it. So if it's numb, that's more important than if it's diabetic and numb.
One of the things I'm seeing more of, and maybe it's just because it's colder up here, is Raynaud's disease.
Mm-hmm.
And do you treat that similar to diabetics?
Not necessarily. So for those of you who may not know, Raynaud's disease, or Raynaud's phenomenon it can be called, is a vasospastic disorder. So what it means is, and it's more common in females, when someone's exposed to cold, it can cause the little vessels or the little muscles around their capillaries to spasm and cramp up. So they'll get cold and even color changes to the tips of their toes. It's a condition that's typically just treated symptomatically, which means that if you keep your feet warm and dry, usually you're going to manage it very well. And so for those patients, that's kind of what we tell them. Make sure you have a good quality sock, something that wicks moisture. Maybe change your socks multiple times a day so your feet do stay dry. Foot powders help keeping them dry too. So a lot of people are aware that they need to keep their feet warmer, but they're not aware that they need to keep their feet drier too. But it is different than neuropathy. In severe cases, they can get enough of a spasm where they do get sores and ulcers on the tips of their toes. But those would be the people that obviously should be seeing a doctor as opposed to trying to find a shoe that would help.
Would toe socks be good at that point?
For some people they could be. Yeah. And for some people, they might need to wear a warmer shoe, but then other people, if they really perspire a lot, they might need a shoe that's kind of warm but also breathes well, right? So it's managing moisture but also managing temperature for them. And that can be a little bit tricky because everybody's a little bit different. I had a patient just this week who she really perspired a lot on her feet, and I thought that was more of a problem than trying to keep her feet warm. So I actually had to give her a prescription of something to manage the moisture of her feet. But she also didn't know about changing socks or wearing socks that have less than 30% cotton to try to keep her a little bit drier. You guys have good socks here that work well for things like that. Any other questions? And I'll be around too. I think we're going to be around for a little bit. But then, like I said, that email thing is going to be great, where you guys can just, even just on the spot, if you get a question on the floor tomorrow, shoot it to me. And we're going to make sure that we get on top of those and address them and share them with people, so we kind of on an ongoing basis can answer questions and fill in gaps and help our customers get better answers.
Thanks very much.
Thanks.